This is Andrew and John David's anatomy project on boxing, and let me give you a little roadmap of what we're going to do. Basically, we're going to give you like a backstory on boxing and some neat facts that I'm sure you'd want to hear, and then we're going to roll the clip with our footage of the jab line, and we're going to slow it down for you. We're going to have a fast version and a slow version. We're going to explain every last little muscle that was involved with the process of doing a jab. Every last one.
Every single one.
And then after the footage, we're going to talk about some injuries you can have in boxing and treatment for those injuries. And also, we're going to sort of refute some sort of tall tales that people have sort of made up about boxing over the years. So...
All right, here we go.
Some facts, bro.
All right, so boxing its origins take place back in 1600 BC in the Greek island of Santorini. It was made officially an Olympic sport in the 23rd Olympiad in 688 BC, and the winner of that was Onomastos Smirneos. Well, a boxing match will last for 12 rounds, and each round is generally 3 minutes long, unless there's a knockout that the ref has to give 10 counts. And if the person can't get up, then that's a knockout, and the match is over.
He's done.
He's done. And
let's roll the clip. Get it rolling. Lights, camera, action.
Go. Alright, here we are in anatomical neutral. Alright, here we go with the elbow flexion. It involves the biceps brachii and the triceps brachii as the primary antagonist. There's simultaneous pronation, which uses the brachialis, the pronator teres, and the palmaris longus, and the flexor carpi radialis and the flexor digitorum superficialis. That's opposed by the flexor carpi ulnaris, extensor digitorum, and extensor carpi ulnaris.
Alright, right here we have horizontal adduction to the humerus pectoralis major. Primary opposition to this is the posterior deltoid. Alright, and in a second or two you're going to have trunk rotation, which involves the transversus abdominis, latissimus dorsi, serratus anterior, and external and internal obliques, the pelvic floor muscles, and the diaphragm if he's breathing, which he probably will be.
I'm pushing off the back foot, so that is a right unilateral hip extension. The primary mover is the gluteus maximus, and the antagonist to that is the gluteus medius. I'm also using the biceps femoris, which is opposed by the iliopsoas major, and the quadriceps, which are the rectus femoris, the vastus lateralis, the vastus intermedius, and the vastus medialis. There is also a plantar flexion, which involves the gastrocnemius. Now the agonist is the anterior deltoid, and it's opposed by the posterior deltoid. With the flexion, there is the primary agonist is the triceps brachii, which is opposed by the biceps brachii.
Right, now we're pretty much going to talk about some injuries, how you can treat those injuries, and then we're pretty much going to spend the rest of our time just sort of dishing out old wives' tales that people have made up about boxing, and give you some neat little facts that you might want to know in case you want to trash talk boxing the next time you do. Alright, let's hear those common injuries.
Alright, so the most common injuries are cuts and bruises, sprains and strains, there's concussions and fractures, and then like dislocation of your shoulder or your glenohumeral joint. Cuts and bruises, treatment for that, I mean, just rubbing alcohol and I mean, if you can't take that pain, then you probably shouldn't be boxing anyways. But there's always hydrogen peroxide, which works just as fine. And then there's antibiotics and stuff you can put on that. And the bruises, just ice that, and it should help. Sprains and strains. The most common sprains and strains are right here in your wrist, your flexor retinaculum. And then your ankle, which would be the medial malleolus of the tibia and your lateral malleolus of the fibula. And there's other ones like your deltoid. You can sprain that if you throw a punch too hard or something.
But those are sort of uncommon. They're more common.
Yeah, the most common ones are in your like your ankle and your wrist.
Yeah.
But treatment for that would be icing that also,
and sort of giving it a rest.
Yeah, and just kind of resting that. And then there's concussions.
Well, basically, there's not a lot of treatment for concussions. Just rest is what surgeons best recommend, or doctors or trainers, because those are really bad, and a lot of boxing injuries are in the head. And speaking of which, surgeons say that 90% of boxers sustain some sort of brain injury having to do with the gray matter in their brain. So that's why recently they've made legislation actually called I believe it's the Muhammad Ali legislation for better protection in boxing, because you don't want to be beat till you can't use your brain anymore. That's not much. It's no fun. Yeah.
And then there's also fractures from not just like throwing the hits, but from also taking the hits. And the most common fractures are like right here in your sternum. Kind of hard to fracture that, but if you get hit hard enough, some of those boxers, there's some studs, and they can fracture your sternum.
Yeah.
And then up here in your face,
your zygomatic bones, teeth, stuff like that.
All those, they can get fractured really easily. And then again, the shoulder dislocation, dislocation of the glenohumeral joint. That's a really common one if you're throwing a punch real hard, and it can get dislocated very easily.
All right. And then basically, now what we've got are some, we've talked about the injuries and treatment. Here's some little unknown facts that you probably would have never thought about boxing. In 1 year, last segment of our video, it's the stretching so you can prevent an injury in boxing. We got first are the shoulder stretches, so you don't possibly dislocate your shoulder, because that'd be pretty bad. And then we've got some tricep stretches, the same. A lot of sports do this. I know when I used to play baseball, we did stuff like this. And then we got another one. Good and stretching. Here's a good one for your hamstrings and quads. It's a lunge, as they call it. Although it doesn't really look like a lunge. And then some squats. It's good for your quads. And basically, that is it. And with those stretches, you probably won't pull any muscles or get yourself really hurt when you box. So that's pretty much the end, as they say. Goodbye now.
Adios.
God bless.